appreciate everybody attending. A few housekeeping notes before we get started. The restrooms are in the back here. You could either access it up this ramp here or go up the stairs and around through the back. There's also a drinking fountain back there, so help yourself. And if you could please silence any cell phones or any other devices that might make some noise, interrupt us a little bit here. We appreciate that. I'd like to also thank anybody that was able to bring any canned foods tonight for the Maui Food Bank. Really appreciate that. And if you forgot, you can always bring them next month. We really appreciate those donations. So first up, we're waiting on Don Couch. He's apparently on his way from the airport, so I had a meeting that ran late, so we will get his announcement, his update as soon as he arrives. It might be before or after. We'll see when he shows up here. So tonight's meeting, we're going to have the NPAC group come up and give a presentation, and then also the YMCA, the Pioneering Healthy Communities presentation as well. And then following that, we'll have John, Mike Morris, and Sandy McGinnis come up on stage for a panel discussion. And then after that, we'll have some brief announcements. We'll have questions. If you have any questions, please wait to the end. We'll do all the questions and answers at once. One question, please, per person, so everybody gets a chance. And then please make it a question. And then we'll do our best to address that. And we will be videoing tonight's meeting, so if you could please wait for the microphones, that way the audio makes it on the tape as well. I'll do my best to keep everybody in queue on the questions, so raise your hand and I'll try to keep track of who's up next. And then with that, we'll go ahead and start the presentation with NPAC. We'll welcome up Mike Morris and Sandy McGinnis to go over the presentation.
Is this thing on? Oh, I guess it is. Maybe turn it down just a hair. Excited to be here. Hope you guys are excited to be here. I just came back from Washington, D.C. I was doing some lobby work for the YMCA of the USA. Very excited. Senator Noy is 100% behind what we're doing. And I won't tell you what we're doing because it's a secret right now. But it has to do with pioneering healthy communities, and which I'm really excited about. I serve on a very cool coalition called NPAC, which is Nutrition and Physical Activity Coalition. Sandy McGinnis is the coordinator. She invited me on that committee, and so I've been chairing it for quite some time, and Sue is my co-chair, as a matter of fact, and does a wonderful job. NPAC is just that. We want to try to make some kind of positive impact on the community. And we do it through several different ways, and I'll let Sandy talk about that. I also serve on a team with Sandy called Pioneering Healthy Communities. The mayor's on it, Councilmember Couch is on it, and in the private sector we got Dan Goodfellow, and we got Westlow from the hospital, and the planning director, Will Spence, and David Good from Public Works, so it's a really good committee. And we are focused on pioneering healthy communities, meaning we want a healthier community by design, meaning bike paths, sidewalks, better nutrition in our schools, all those kind of things. And the Y has been involved in a lot of different things across the country. And we've decided here in Maui that we want to really dive into developing healthier communities. And the reason we are starting this program, and I'm going to run through a couple of slides right here to show you what's happening in the country right now. And it relates to a couple of different things. Obesity is one. We don't like using obesity. We like to say inactivity and poor nutrition. Okay? So we're not as active as we should be, and we don't eat as well as we should. And it is becoming an epidemic in a lot of different ways. And diabetes is showing up now in very young ages that it didn't used to. It used to be an old man's disease, like me, but it's showing up a lot earlier now. So let me show you some of these. These are about overweight people in the United States. This is all the way back in 1985 when the Center for Disease Control was was starting to track this kind of thing, and you can't hardly see, but it says the blue states are about 10% of the people were overweight. We moved 5 years later, and you see now almost the whole country is overweight, just 10%, so not too bad. We move another 5 years, and you can see how quickly this is starting to grow, and we've added a different color. Now we're up to 15 to 19%. Year 2000, we've added another color. Now we got half the nation is 20% is overweight. We've added one more color now, 25%. Now we're getting up there, big numbers. Some states in my home state, Indiana, thank God we were first to be fat, so great state to be from. 2004, a lot more red. Now we're getting about a quarter of the country, about a third of the country is 25% are overweight. Now we've added 30% with the black in here in 2005. Then the Center for Disease Control came to the Y and said, we want to get involved with you guys because you guys are really good at keeping the healthy healthy. Let's talk about the unhealthy and how we might address the unhealthy. So they started doing charts. So now they've got really fancy charts. It breaks it down by county, and you can see that all the red and dark colors are in the 25 to 30% range. We moved to 2007, and it just continues to get darker and darker, and 2008 is the last one I have. If you ran through these and think of about any disease there is, and you run through these and start looking at the spread of it, that should scare the tar out of all of us. I mean, it should just terrify us. Pick a disease. And if it were spreading across the country like that, what would you do? So we're interested in solving that problem, but we can't do it by ourselves. It has to be a community attacked problem. And you say, well, why is it, we go to McDonald's, we eat too much, and we get a little overweight. What's the big deal? What's the big deal? And I'll tell you what the big deal is. There's two things that opened my eyes when I first went to D.C. to talk about these issues. And one of them is it's a big number. It's billions of dollars nationally. But here, and this is old stat, 2003, obesity attributed to $290 million of expenditures in Hawaii alone in 1 year. In 1 year. So we're spending $300 million taking care of and treating obese people with diabetes and those kind of things. But here's the one that really scared me. For the first time in modern history, in 250 years, we've been tracking stats about everything, that the generation today, growing up, as a result of inactivity and malnutrition and diabetes, will not outlive the generation ahead of them for the first time. Think about it. My son will not outlive me, as according to this, from the Center for Disease Control. Scary, very scary stuff. So while I was in Washington, we talked about where are we spending our money? Where are we spending the money on Medicare and Medicaid and all of the expenses for hospitals and those kind of things? This is where we spend it. We spend 98 to 99% on treatment. We spend 2, maybe 3% at best on prevention. But here's the thing. It costs let's say it costs $1 to keep me healthy. On the other end, if you don't keep me healthy and you got to treat me, it costs $3.60. So prevention is the answer. Prevention is the silver bullet to our budget problems. It's the silver bullet to our national debt. We went and asked for a program. It was $80 million to do preventional work. And by doing that work, spending $80 million, we will save $191 billion over a 10-year period by treating it early. And we're talking about diabetes. And we had the largest healthcare organization in the country, United Healthcare, came to the Y and said, look, we want to join up with you guys and start this national diabetes program because we know it works. And we said, well, why do you want to join with us? Well, you're a big healthcare industry. Why do you want to come with the Y? And they said, well, let me tell you something. If we don't do this treatment or this prevention program now, In 7 years from now, we'll be out of business. We won't be able to insure the people because of the growing epidemic of obesity and inactivity and diabetes. Think about that. Healthcare companies in the country are saying, we'll pay you to do this program because we can't afford it on the back end. Scary stuff, scary stuff. So how does that involve us and what we do here in Maui? You know, we're talking about building high school right now. And we talk about developments, and we talk about different things in our community. And you look around Maui, and I know that I lived right over here, and my son went right over here, and he couldn't. Hello, councilman. Welcome. You missed the best part of my presentation already. Where you been? I know he's been doing some good legislative work over in Oahu, so welcome back. I hope you didn't speed. Okay. So we lived right over here, and my son couldn't walk to school, which is about a quarter mile, because it's too dangerous. Not good sidewalk, not good bike paths. Shame. How many of you walk to school? I did. How many of your kids walk to school? God, everywhere I go, this is what I see. The kids aren't walking to school anymore. So it's time we really focused on it. It's time we really started doing some preventative stuff. It's time that everything that we talk about and we do from this point on is about how do we prevent us? How do we design a community? How do we design it where we get out of our cars because it's more convenient to walk? How do we do that? And you can do it. You really can. Some of it's pretty simple stuff. How do we do better nutrition in our schools? Some of it's really simple stuff. I'll tell you one more survey that I read that's really interesting, and then we'll let Sandy come up and talk. Nutrition in schools. We did a survey for 3 weeks. We went in the high school. We looked at what kids were eating and how they were eating it, and they were going through the line, and the hamburger and the french fries and the Cokes were really right there. They could grab it and eat it because it was convenient, and the fruits and the vegetables and bananas and apples and those kind of things they had to ask for it, or they had to reach to get it. So we changed it, just flip-flopped it. They had all the good stuff there, they just weren't eating it. So we put all the fruits and vegetables and everything right up front. And then the kids had to ask to get the hamburgers and french fries and that kind of thing. What do you think happened? Kids are just like anybody else. They're like me, whatever's convenient. If it's right in front of me, I'll eat it. I don't care what it is. If it's right there, I eat it. M&Ms, salad, M&Ms. The salad, if it's reversed, I eat the salad, right? So true enough, 200% increase. 200% increase in the number of kids that took fruits and vegetables and ate it because it was convenient. How much did it cost that school to change? Zero. Cost them zero. So changing the defaults, changing, what if McDonald's, the Happy Meal, wasn't a hamburger, french fries, and a Coke? What if it was the apple critters and a hamburger and milk? They sell that. What if that was the default and they had to ask for the other one? And all the millions and millions and millions of Happy Meals they sell, you're talking about billions and billions of calories in 1 year. So it's out there, it's doable, it's easy stuff. We should think about it, everything we do. The high school should be walkable, rideable, get our kids out of the car, make it convenient. I'm also for roundabouts. Just had to put that plug in for it. Do what you can to help us. Get involved. Talk about those kind of things when you talk to your elected officials. When you talk about general plans and those kind of things, where are the bike paths? Where are the sidewalks? So let me bring up the coordinator of NPAC, who does great work, and she can fill you in a little more on what's happening with NPAC. Okay. Oh, there's a good design right there. You need some help up here? You can.
Thank you very much.
Good evening, everybody.
Good evening. Okay. Thank you. Hello? It's on? Okay, thank you. Thank you. This is our mission statement of NPAC, and as Mike mentioned, he's our board chair. He's been our chair for 4 years now, and we are very grateful to be partnering with the Maui Family YMCA, which is actually expanding, going outside of its, four walls, and really working on community development. And this is the reason